thanks for your service. Thanks for putting up with all this abuse. But in particular, thank you for your commitment to radical transparency. I think you're aware of the fact that I, on many fronts, think our response to the pandemic was a miserable failure. I'm also well aware that because the pandemic's over, so many people just want to put it behind us. Let's not examine all the things that went wrong. One group of people who do not want to move on, one group of people that insist on a reckoning, are those who were injured by the COVID mRNA injection. I think you're aware of the fact that on VAERS today, worldwide, we have almost 1.7 million reports of adverse events, almost 39,000 deaths. By the way, of those deaths, 24% occurred either on the day of injection or within 1 or 2 days. Now, I know VAERS doesn't prove causation, but man, that's a correlation. The injection injured, I refuse to call it a vaccine, it's not a traditional vaccine. The injection injured, at a minimum, would like to have their injuries acknowledged so they can get treatment. I saw a horribly sad video of a man in Japan, the central line, being effectively treated for his injection injury, couldn't get treatment here in the U.S. One of the things preventing is we have no ICD code for those. So I know this is running through HHS. I think NIH Director Bhattacharya is looking for an ICD code. I'm just asking you if you're willing to look at that and prioritize that to get the injection injured at least an IDC code and acknowledge these injuries. Would you make that commitment?
We are working on it, and we are working on it. We're trying to make that happen as quickly as possible, and we're also doing the studies that now need to be done at NIH, the coroner's reports on the blood, clots and all of these.
I'm glad you talked about coroners. So my next question is a memo that is apparently leaked from CBER Director Dr. Prasad in December 2015, where apparently within FDA you're reviewing, I think it was 96 autopsies of child death following the COVID mRNA injection. In that memo, Dr. Prasad writes, "This is a profound revelation. For the first time, the U.S. FDA will acknowledge that COVID-19 vaccines killed American children. Healthy young children who faced tremendously low risk of death were coerced at the behest of the Biden administration via school and work mandates to receive a vaccine that could result in death. In many cases, such mandates were harmful. It is difficult to read cases where kids 7 to 16 may be dead as a result of COVID vaccines. Putting these facts together, it is horrifying to consider the U.S. vaccine regulation, including our actions, may have harmed more children than we saved. This requires humility and introspection. It requires oversight." And so I wrote a letter to you and your agency back on December 15th. Of the 10 responses, I got 3 out of 10. No responses, no response in terms of the documents I requested. So I'm asking you, please, will you commit to responding fully to my December oversight letter?
You have my 100% commitment.
In the letter, we also mentioned the fact that I was requesting the deliberative process on the Biden administration last minute requesting or granting a 4-year extension of the liability shield for these COVID injections. So please, would you also commit to providing me that deliberative, those documents?
If we have them, I will hand them over to you.
Finally, let's just put up this graph. Because of your radical transparency, I've got close to 11 million pages. We uncovered they hid the signal on myocarditis. We also just recently uncovered that they also hid a signal on ischemic stroke for people over 65 by the tail end of 2022, 2023. They hid both signals. They downplayed them. But what is most alarming, and we'll be holding a hearing on this next week, I've got a draft report. They were made aware, Peter Marks was made aware on March 26th of 2021 that the inventors of the algorithm that analyzes the VAERS data was going to mask adverse events. He was told that by using a different system, they had uncovered 49 examples of extreme masking, 25 significant adverse events, including sudden cardiac death, Bell's palsy, pulmonary infarction. So this report will be issued in conjunction with that hearing. Again, I didn't need a sophisticated mathematical model to tell me that we had safety signals screaming at us. This chart shows the deaths associated with the vaccines all the way going back to 1990 when theirs started, a couple hundred a year. Anaphylactic shock, that type of thing. 2021, over 20,000 deaths, and for 5 years, FDA has been saying, we don't see a signal. This was a signal screaming at us that to this very day, we are covering up. So there are a bunch of people involved in this cover-up that still continue to work within the HHS, CDC, FDA. I want your commitment that those people will be made available for interviews. I'll have to subpoena others. I'm going to dig into this massive government.
You have my commitment.
Thank you.
Support journalism you trust. Support PBS News. Donate now, or even better, start a monthly contribution today.